Alors, bonjour s'il y a des gens qui nous joignent ce midi et bon appétit aussi. Alors, bienvenue Lisa, merci beaucoup de me rejoindre aujourd'hui pour notre discussion en direct. J'avais vraiment hâte de jaser avec toi. Alors, Liza Selvarajah est orthophoniste. Elle est la fondatrice et la propriétaire de la clinique d'orthophonie Montreal Speech Therapy. Lisa est clinicienne enseignante à l'Université de McGill et elle a supervisé également le département d'orthophonie à la clinique Tiny Tots de 2016 à 2021. Et avant de devenir orthophoniste, ça c'est intéressant, Lisa, tu étais enseignante au niveau primaire et secondaire. Alors ça, c'est quelque chose que j'ai appris de toi récemment. Lisa aime, sur son temps libre, elle est membre de la troupe de danse Montreal Steppers et elle est également dirigeante de la chorale gospel de Montréal. Et Lisa, tu tiens à cœur les pratiques inclusives en matière surtout de neurodiversité auprès d'élèves autistes, fait que je pense que des pratiques inclusives, ça s'applique un peu partout. Et tu es co-animatrice du balado The Bold SLP. Donc, vous pouvez les retrouver sur Instagram ou sur le podcast The Bold SLP Collective. C'est super intéressant. J'adore vous écouter. Vous allez même en direct des fois. Ça n'a pas de lien avec votre podcast, mais vous allez en direct, je pense, à toutes les semaines.
Oui, à chaque mercredi soir.
À chaque mercredi. Ah oui, et je ne veux pas mentionner un point important. Tu es aussi mentor au programme de bilinguisme en orthophonie pour Asha. Et donc, ce que j'ai appris aujourd'hui, c'est que tu as étudié, tu as fait ta maîtrise aux États-Unis, alors tu es certifié ASHA, donc the American Speech and Hearing Association, et aussi de l'Ordre des orthophonistes et audiologistes du Québec. Alors, bienvenue.
Merci. I wanted to make a small little correction on the bilingual mentorship program.
Yes, tell
me. Because ASHA has their own called the STEP mentorship program, which is, but that one wasn't as diverse as I would have liked. So I'm in the bilingual mentorship program that was created with Instagram bilingual SLPs.
Oh, okay.
So we have a huge wait list and I meet with a student every Friday.
Super.
A Spanish student from the US, yeah.
OK. Fait que toi, tu rencontres des élèves de partout ou juste des États-Unis ou au Canada? Comment ça fonctionne?
C'est de partout, but it's SLPs of color and bilingual SLPs.
Okay.
So, yeah, there's from Chile, from different places. My mentee happened to be from the US.
Okay. And what happens if a monolingual SLP would like mentorship on bilingualism?
They can sign up as well, but it's more for them to see themselves and see representation. Because there's a lot of mentorship out there for regular white SLPs, but there's very little representation for SLPs of color.
Great.
So that's why we started that.
So how long ago did you guys start that?
I just got my mentee a couple weeks ago, but I think it started a few months ago. It's very new. They were trying to put it together. A lot of us on Clubhouse, do you know that platform?
Yes, I do.
Yeah, there's a bilingual SLP group on Clubhouse. So that's where I met them. That's where I met my podcast girls.
Oh,
so that all started there. But we really have a heart for just SLPs, bilingual SLPs and SLPs of color who just don't know what to do or how to move forward because there's no one in these high-ranking spaces that look like them.
OK, great. Lucie, j'avais pas compris exactement c'est quoi le but du programme de mentorat. Alors, merci d'avoir clarifié ça. Super. Tu vois, tantôt, on s'est jasé un petit peu avant notre live, puis là, j'ai appris que tu étais membre de ASHA, alors je pensais que ça faisait partie de ASHA, mais merci de clarifier ça. Et là, le programme, ça dure combien de temps? Comment tu vois ça? Je sais que vous êtes en train de le développer, là, j'imagine.
Oui, c'est en train de développer, puis il y a toutes sortes de questions parce que, I'm from Montreal, and so my bilingualism is the English-French, whereas I'm having a student who's Spanish-English, and so I was really worried, even to come on your live right now to talk about bilingualism in that way, but sometimes it's more than just speaking two languages. It's all the culture that you're bringing with you, the differences that you see that you don't see everywhere, so you always kind of have to tiptoe around what's appropriate, what's not, what is accepted, what's not. So really, for our mentees to feel accepted just the way they are and that they don't need to change to fit a certain standard, that was the big goal. And even questions about pay and questions about what to say in interviews. I mean, no one really talks about these things. We focus on standardized testing and things that end up out the window anyway when you're a first, second, third year clinician.
Yeah.
So it was important to have this space for them to be able to discuss these things very openly and not feel judged.
Oh, I love that. I love that. And I think that's really important. And I think you've had some experiences of your own, which maybe we can talk about in a little bit. You know, you've had your own. Yeah, well, I'll keep that on the back burner. You know what I'm talking about. But I wanted to dive in. So my goal with these lives, mon objectif, c'était pas nécessairement d'inviter des orthophonistes qui sont bilingues. Ben, c'est sûr que les orthophonistes que j'ai invités sont bilingues parce que je pense que d'être déjà bilingue, ça aide à pouvoir intervenir auprès de ces populations-là, des immigrants, des réfugiés, des enfants allophones et tout ça. Mais, puis là, je sais que tu te sentais comme peut-être imposteur, un peu comme « Oh non, je parle pas de moule. » Ouais, je pense que c'est un petit peu notre... c'est le cas pour plusieurs orthophonistes, hein, on se sent souvent imposteur, mais on n'est jamais imposteur quand on a des expériences à apporter. Je pense que tu apportes beaucoup de valeur. J'aime beaucoup écouter votre balado. Vous parlez beaucoup de sujets qui sont peut-être des sujets plus délicats. Et puis, ben, j'aimerais adresser ces sujets qui sont délicats. Là, j'essaie de prendre le point de vue en orthophonie, comment est-ce qu'on peut nous apporter des pratiques qui sont plus inclusives auprès de nos populations, qui sont plus diverses linguistiquement, culturellement. Et donc, tu voulais me parler, ben, en fait, j'avais envie de t'entendre par rapport à des expériences que tu aurais vécues avec des populations variées ou des langues variées. Comment est-ce que ça a influencé ta pratique? Est-ce que ça a apporté des changements dans ta pratique dans les dernières années?
Yeah, so I worked with a lot of immigrant families when I was at Tiny Tots, a lot of families coming from all over that were referred by the pediatricians. And so back when I was a first-year clinician, I was really trying to prove myself, prove that I belong there, like among the doctors. I would use a lot of big words. I wanted to sound like scientific and smart, and I wasn't really getting anywhere with the families. I mean, it's like I took pride in the fact that they weren't really sure what I was doing, but I was like the authority, and I was the one that did the master's degree.
Yeah.
And then, I mean, after a few sessions and families are returning and no real progress taking place, I was like, there's got to be something else I can do. And maybe if I just drop certain terms and just like speak normally, that was one thing. That was one thing I had to drop right away. Words like severe and moderate to severe, and like, that doesn't mean anything to families. It's really just like, here's where your kid is. Here's what they're saying right now. Here's what we would like them to say.
Yeah.
Maybe in the next few weeks, we'll work on that. And I mean, I don't mean saying, but just communicating. I want them to communicate this way. So a lot of times I did not take the time to get to know the families as much as I should have. And I just like jumped into therapy, jumped into evaluation with these very scared, shy kids, sometimes new to the country, definitely new to the clinic.
Yeah.
And I was like in this like mad hurry to like get results.
Yeah.
I wanted like that progress sheet done. I wanted a lot of pluses. I wanted to prove my worth, basically. So now I have shifted all of that. And it's like, I am not the authority. I'm not anything. I'm here to collaborate with you, the mom, the dad, the caregiver, whoever comes in. And I want to know what you would like from me. And like a big question I have is, what does your daily routine look like?
Yeah.
From the moment you wake up to the moment you go to bed, what do you do?
Like? Yeah. Because that's different for everyone.
Yeah, that applies to everyone. And like this whole inclusivity business makes it seem like it's like a white world and now we're including the people of color. But it's like, no, we're including everyone. These are good practices for everyone.
Absolutely.
Everyone should be thinking of each other when they're developing these programs or tests or whatever.
Right.
So a big shift for me was listening to the family's perspective and just like literally throwing my agenda out the window. Like milestone guide, whatever. Like, where is your kid now and where would you like them to be?
Right.
Now, setting expectations, that's where my master's degree comes in, I think. So it's like, you know, I have a 2-year-old and I would like him to be like reading books by tomorrow, you know? That's not really what 2-year-olds do. Some of them are very, very advanced, and you know, you could throw all these letters and letters on association if you want to.
Yeah.
But working on like making friends and playing and like that connection, working on that connection with the kid, between the kid and the parent.
Yeah.
And then there was like, and I'm going all over the place, sorry.
Yeah, no,
but like,
go ahead. Very interesting.
This like clinician-centered therapy where like the child is like so dependent on the therapist and like only does it in the therapist's office, only did it for me. And parents would often say like, they do it for you, Lisa, but they never do it for us. And when I first started, I like took pride in that. Like, yep, I'm able to do it. Instead of
thinking,
wow, I wonder why they don't do it for you, and how can I help you get there? Right. Why don't you sit in with me? I mean, I was too afraid to have them in the room anyway, because I wasn't, you want to talk imposter syndrome? Back then it was like deep. Yeah. Really deep. So well,
I think that comes with experience, right? I mean, new clinicians may or may not feel that way depending on the experiences they had also in grad school, which are quite limited, but yeah. And the mentors you have too, I think that's important.
Yeah, and I didn't see many of, I never saw like relationships that were built between therapists and families. What I saw was therapists giving results to parents.
Yes.
That's what I saw. After every session, your child was able to do this today. Next week, we're going to work on this. That's what I would see. Not, how are you feeling about this? How do you think your child feels in this moment? Do you think that this is a good goal for them? You know, like sometimes parents would like increase vocabulary, typical goal, or increase MLE, right. One of those, you know, and like we would have these like little cue cards with like broccoli and celery and, you know, those multisyllabic words, things like that.
Yeah.
And only to find that the child like only eats like mangoes and rice at home. So these are words that are not even part of their day-to-day life.
But have you taken the time?
This like pre-packaged like activity that's like, I'm so happy to do, I'm so happy to work on. And I like, I just used a lot of tools that were pre-made because I trusted like the experts who had no idea what families I was going to be working with.
Yeah.
Exactly. So I just make my own stuff now, and it's all dynamic assessments right now.
Dynamic assessment. OK, so t'as apporté beaucoup de bons points. Fait que je pense, de ne pas oublier, je pense qu'on est tous des humains, et de pouvoir relater à la famille. Donc, si je prends le temps, je suis à l'écoute des besoins de la famille. Parce que souvent, c'est ça, nous, on a une idée, on rentre, on a des attentes. Mais les parents, eux aussi, viennent avec des expériences ou des attentes différentes des nôtres. Fait qu'il faut prendre le temps d'écouter, de discuter avec la famille. Et j'aime ce que tu disais, tu sais, enlever un peu le langage qui est très technique. On n'a pas besoin d'impressionner les parents. On a besoin de les écouter, de comprendre leurs besoins, le besoin des enfants, bien sûr, et de prendre le temps de voir c'est quoi leurs besoins dans leur réalité. Hein? Comme tu disais, de demander un peu c'est quoi la routine. Moi, je le fais tout le temps. On va décrire comme heure par heure à quoi ça ressemble parce que moi, je peux proposer des activités qui n'ont pas du tout rapport avec cette famille. Puis je peux trouver que c'est bénéfique pour une famille, mais pas du tout bénéfique pour une autre famille. Hein? Et travailler le mot brocoli, s'ils ne mangent jamais du brocoli à la maison, ça ne nous sert pas à grand-chose.
The little tree, yeah.
OK. Fait que là, wait.
I was going to say that the pandemic really helped in terms of seeing the lives of the families that I serviced because I saw into their homes. I saw like, I mean, whatever they allowed me to see. But like, you know, things like getting their child to sleep, not knowing that there wasn't a separate room for the child. It was with the parent. And so that's a whole other ball game when you're trying to give advice on what to do. You know, we talk about reading the child a story and then like, saying goodnight to them. And then we have parents who can't read. So like you have to think about these things when you're implementing these like standard goals.
Okay, so I have a question about that. So for parents who can't read, like how are parents, do you feel like parents have been comfortable telling you this? Est-ce que c'est quelque chose que, parce que moi, je vais demander, est-ce que ça fait partie de votre routine? Est-ce que vous lisez avec votre enfant? Est-ce que c'est quelque chose que vous aimez faire, que votre enfant aime? Je vais poser des questions plus générales de ce genre. Fait que si le parent me disait non, comment est-ce que je peux savoir, ou qu'est-ce que tu ferais, toi, pour voir, comme pour comprendre le pourquoi est-ce que ça fait pas partie de la routine? Je pense que de poser la question,
What? So I used to ask, like, I mean, very judgy questions like, what kind of books do you read to your kids, you know, instead of like listening for the routine to see if did they mention a book? And then I would ask, like, do you ever read stories with them or to them? And most parents would say, oh, I try to, but I don't have time, whatever. But I had one parent recently who was like, I can't read. Oh, okay. So that's just not going to happen. So just right off the bat. So I talk about
families will give that information right away, right? You have to build that trust. Hein? Il faut vraiment établir ce lien de confiance parce que il peut avoir de la honte aussi.
Oui, mais je sais dès le début de la manière qui remplit son formulaire. I could tell the language, the English language level based on the intake, which I love because it helps how I'm going to communicate with them, what I'm going to say, what kinds of words I'm going to use. I had one dad a couple years ago who's all about statistics, wanted to know exactly the son's percentile ranking and this and that. So
I've had parents like that too.
Yeah, so you have like the whole gamut. But universally with my clients, they all wanted to see if I truly cared about their kid.
Yeah.
If I truly cared and not just like, if I'm judging their kid, are they smart or not? Are they? I get that question all the time, but he's smart, right? I'm like, of course he is.
Of course
he is. Like, of course they are. I am not checking their intelligence. I just want to know the way they communicate right now and how I can help them.
You. Yeah.
Yeah, exactly.
Help you help them.
But sorry, but I didn't answer your reading question.
Like what
I would tell.
Well, yeah. you kind of did. I mean, I'm just going to reiterate that. Le point que tu as apporté, en fait, puis ça, c'est quelque chose que moi aussi, je vais utiliser. On a peut-être des plus jeunes orthophonistes qui nous écoutent, qui ont moins d'expérience. L'histoire de cas, moi, je la donne à l'écrit parce que certaines familles ne peuvent pas le remplir à l'ordinateur, même si j'ai une version électronique. Mais ça va me donner des informations parce que je vais voir comment ils répondent aux questions. Je vais voir un petit peu aussi l'orthographe. C'est pas pour juger, mais ça va me donner des informations pour que moi, je puisse m'ajuster, comme tu disais, ajuster mon langage, ajuster ma communication. C'est sûr que quand je rencontre le parent après, ça va m'aider aussi de voir comment répondre oralement à mes questions, mais déjà là, ça donne des informations.
But reading, I tell them also, like, to me, at first, it's the bonding part of reading. The literacy skills and everything comes after for me with reading. But sitting with your child, being there, cuddling with them, like, they just love that moment together. Well, many of the kids. So if you can't read, you can look at the pictures and just come up with a story on the spot, especially if your kid's not reading it either. It's really okay. And a lot of parents think it's like word for word or else you're doing it wrong.
Yes.
And I'm really trying to dispel, there's not much you can do wrong. Like, they're just tools all over the place and you use them the way you need to without harming anyone to like get the job done. You know, a lot of these tools are so strategically standardized that like everyone's too afraid to touch them. And that ends up more wrong. I think the way they use it very strategically and in a standardized way makes it wrong.
Like, don't repeat it more than once, or they have to get a certain number, and then you can go ahead. Well, even if they failed all the practice items, I'll still sometimes go ahead to see. I'll adjust, I'll give cues, and I'm going to check and this is dynamic assessment, is that I can give cues and I can note down what's helpful, what's not helpful. If a child doesn't know a concept, and then I can teach that concept on the spot or on the next session. You know, if you're not so well versed, you don't have that much experience, but you can take notes, you can cue on the spot, see what's helpful, what's less helpful. And then you can take that on a second session and adjust yourself. And you can try and teach one of those concepts, you know, for like you were saying before, broccoli. Okay, so they don't eat broccoli. The kid doesn't know what broccoli is. Can I teach this child broccoli? And is the child learning this word on the spot? How much support does the child need to learn a new word, to understand it, to use it? This is dynamic assessment.
Exactly.
Yeah. So, but I love how you're saying, like, we don't need to focus on literacy. These are pre-literacy skills, even just flipping through a book with your child, bonding.
Yeah.
But I think
their interaction with the book, what they're looking at, do they even notice their words on the page? Do they know how to hold it? You know, like how much do they, what kind of relationship do they have with books? That kind of thing also.
Yeah.
There was something you were mentioning, and now I'm thinking about broccoli, but
sorry, I keep talking about broccoli.
In terms of dynamic assessment though, I think for the clinicians out there that are worried that I don't have a score, I don't like have like an exact number, the thing that I'm learning about all the standardized tests is that any kind of help or support leads to a 0 score. So
which I don't care about.
I don't care about either, but if you need the funding, then you have to put some kind of score on there. But I need to know, like you said, how much prompting did I have to offer? Like, what kind of repetition did they need? Was it like an immediate one, a deferred one? Like, do they know that I'm even speaking to them? Like, do they know I'm trying to help them, or is their mind elsewhere? Mm-hmm. Like, all of that is like the rich material that will go into the dynamic assessment report. Exactly. And then you could put your score of 0 if you want to, because they didn't get the answer without help, you know. Mm-hmm. Like, that's the thing with the standardized test. If you give any kind of help or like break protocol, it's a 0. So if you know it's a 0 already, fine, you got your score, great. Yeah. Now work on the meat that's really going to help you like, create an intervention plan.
I love what you're saying here, but the problem with standardized tests is that they're not valid for most of the kids that we're working with, because worldwide, half of the worldwide population or more, I don't have the exact statistic in 2022, mais comme peut-être plus que 50% de la population mondiale parle plus qu'une langue.
Oui.
Parle et comprend plus qu'une langue. Fait que les tests qu'on utilise standardisés ne sont pas valides du tout. Puis ça, c'est une question qui me revient souvent des orthophonistes qui viennent prendre ma formation. Puis je veux le réitérer, ce point-là. C'est qu'on peut passer des tâches standardisées. Comme tu dis, si on modifie quoi que ce soit dans la tâche, le score, techniquement, c'est 0. L'enfant a échoué la tâche, puis là, on a 0 information. Puis ça, c'est le problème avec des évaluations statiques. Mais dans le moment propre, on peut être dynamique en offrant justement des répétitions. Quel genre de répétition? Quel genre d'indice? Est-ce que l'enfant porte attention? Est-ce qu'il porte attention au message verbal? Est-ce que l'enfant s'est rendu compte qu'il a fait une erreur? Parce que j'ai des enfants, des fois, qui vont se reprendre. Puis là, ben, des fois, je vais faire une pause, puis je sais que j'ai donné un indice à l'enfant, mais finalement, je vois que l'enfant a changé de réponse, puis là, il y a eu la bonne réponse. Alors, j'essaie de... Au début, tu sais, là, je vais dire, ben, est-ce que tu peux me remontrer une autre fois ta réponse? Puis là, il va être comme ça. Mais on est censé prendre la première réponse donnée, right? C'est censé être... Ça dépend des tests. Ça dépend. En tout cas, mais c'est tellement pas...
All over the manual of standardized tests, it says to use clinical judgment, which is why you need like whatever degree to even be able to administer these tests. Or else anyone could administer a test and say, what's this, 0, 0, 0. Yeah. Anybody could do that.
Yeah.
So when they talk about using clinical judgment, that to me is where you're kind of bleeding into dynamic assessment. At this point, if you're using more judgment than the actual scores, then you're just dynamically assessing, and the test is just a tool to get you the results that you need or you need to see.
Yeah.
But to me, I always talk about the scores as soon as I meet with a parent, just to like dispel any fears that they have. Mm-hmm. Severe to me doesn't mean your child is terrible and like they're never going to make it. Severe is this ridiculous word I have to use to get your child funding. So on this specific test, on this specific subtest, they scored in the severe range. Therefore, they meet criteria to get the funding so they can continue working with your kid. Exactly. That's all. So if you take the time to explain that to parents instead of just having them see severe, it's not as scary.
Yeah, I totally agree. And we talked about this in my other lives. You know, I was talking about like, again, these are recurring questions. Comment est-ce qu'on fait pour mettre un score quand c'est une évaluation dynamique?
Okay.
Mais est-ce que c'est vraiment ça l'information qui est importante? Bon, il faut équilibrer entre, on veut que l'enfant ait accès à des services, donc il faut qu'il y ait certains critères. Malheureusement, c'est la bureaucratie, right? Oui. They have to fit in a box to get the services that they desperately need.
Yeah.
So we can balance that out. Hein, on peut prendre on peut utiliser certaines tâches, mais il faut équilibrer aussi avec d'autres moyens où on ne peut pas mettre des scores ni une sévérité. Mais je pense que là-dedans rentre le fonctionnement de l'enfant. Fait que si on regarde dans un contexte social, dans un contexte académique, ça aussi, c'est des informations qu'on peut recueillir auprès de la famille, auprès de l'enseignant, dans des environnements différents. C'est très important.
It's true. It's so important. And the thing is, I use the standardized test to my advantage. I say I tried it, it didn't work. The child's not able to sit still or point or whatever.
Right.
And then right away, the fact that they weren't able to complete the standardized test tells me about their academic skills and what the expectation would be at school. So that's enough for me to say severe. I don't have to sit them down, get them 0 all the way till we hit ceiling and waste their time.
Yeah.
Like I try a couple of them, I try a couple demos. I still use it. I still use the scores, but that's one tiny piece of my dynamic assessment.
Yeah.
Whereas in school, we were taught to rely heavily on the standardized testing and a whole battery. And like when I first joined the board, it would take me like
which board?
8 sessions. The
OAQ?
A school board. I don't know if I want to call them out.
Okay.
When I first joined a school board, it took me like 8 sessions to evaluate a child. Standardized test after standardized test after standardized test. Them sitting at a table, me trying different things. Okay, this test didn't work. How about this? How about this? And they would run around, and instead of just sitting and playing and trusting myself that this game will give me the information that I need.
Yeah.
But it was too scary because I wanted them to get the funding, and I didn't want to like waste anyone's time, which goes back to our original point of meeting these families and feeling like the discussion with the family while the child plays on the side is not part of the assessment. Of course it is. It's like very valuable information that the child cannot give you themselves.
Mm-hmm.
But all of that is part of the testing.
Oui, mais tu as apporté un point important aussi, comme tu disais. Je pense plus jeune aussi dans notre carrière, on se met, nous, des attentes, comme toi quand tu as travaillé à la clinique Tiny Tots, tu voulais bien paraître, bien faire, démontrer tes habiletés, pas juste à ton cadre de travail, mais aussi aux familles. Et tu disais aussi, tu ne veux pas faire gaspiller du temps. Hein? You didn't want to have that feeling like you're wasting people's time.
Yeah.
But at the end of the day, we're wasting time if we're not gathering any information that's helpful for treatment.
Yeah, so there was something, and I think I got this from school. I think I got this wrong information from school, but if I couldn't write down something progress related, even if it was 0, I felt like the time was not wasted. But when I would
say that again, if you felt like?
So if I felt like I couldn't write down some sort of goal about what I just did, even if it was a 0, I felt like that time was like well spent because I worked on something. But if I'm gathering this like rich information from the parent about what the kid does all day and for some reason I didn't find that time, I felt I wasted their time. That was not valuable. That had to be done outside of like the child's therapy time.
Right.
But once I like forgave myself basically and was like, no, this is all related. This is all part of it. It became much smoother. The expectation was realistic and appropriate.
Yeah.
Because I could sit with a child and play Papa Pirate for hours and hours and hours and just keep giving them 0s. And that is a huge waste of their time.
And hours.
And hours, exactly. And then I have to write up about it and figure out, like, what did we really do?
Yeah, and then you're sitting and you're like,
he didn't even make the sound
to
once.
Say about this kid. Yeah.
Oh, and the teaching. We even talk about the teaching. Okay,
so I just wanted to make a point about what you just said, which was, now I'm losing my train of thoughts, that taking the time with the parents is part of our work.
Yes.
And this is something that I teach in my workshop is I've added a whole extra hour for interviewing parents. And sometimes I'll do it like, I send them the case history first because I like to see just what they're going to write in the written form. And then I complete orally, and then I have add-ons if it's a bilingual, multilingual family of like questionnaires like language exposure, routine. I ask that to all my families, like what does their routine look like? But where was I going with this? So adding that extra time is part of it. It's part of intervention as well, taking the time to see how things are going. Is it working for them? Am I suggesting things that is helpful for them? But also I think like, because I know you work privately too, but you work in a school board and you work privately. I feel like privately we have a bit more pressure that we put on ourselves because our clients are paying and we're like, I have to get results. And there's also like, so like that early on, I just graduated, I have to get results, I have to show people results. But all of this, taking the time is contributing to that.
Yeah.
Yeah. So you wanted to talk about teaching.
Yes. So I think SLPs in general in schools are not taught how to teach something.
Yes.
They're only taught to test and to then check over how many times they got it later. Like they'll tell a child, do this. And then they'll test them 25 utterances, see if they got it. And taking that time to teach without the data collection, just the teaching part is a huge part of what we should be doing.
Because this is
And
dynamic assessment. It's the teaching part and
Yeah,
how the
but-
child is responding.
But even after the dynamic assessment is done, during intervention, what I've seen when I observed as a student, when I observed intervention sessions, was just the child doing all the work.
Yeah.
And the SLP like noting down how many times they said the sound.
Yeah.
And they might stop for a second and like show them and then go again. I'm talking specifically artic therapy.
I totally agree.
So taking the time to stop and teach them, even if it takes half an hour to teach, it's worth the time because then they'll actually get it.
Yeah.
Because it's like, what does JRC, the SLP, say? She says connection over, I can't remember now.
Yes,
connection over collecting data, something like that.
Yes. Okay. So JRC, the SLP, you guys can find her on Instagram. She's, yes. Great source of like wisdom, and just go and follow her.
Yes. She's huge on like anti-racist movements, and like, yeah, she's really gives a platform to SLPs who don't usually have their voices heard.
Yeah, exactly. So yeah, connection. I always talk about connection, and I think that.
Oh, I think it's connection over data collection. I think it's that. I think that rhymes.
Yeah, that's good. That's good. So if there was a take-home message, because believe it or not, time flew by. It's already been half an hour, and I didn't want to stretch these lives out too long because I want people to come back and listen to them. And if it's like an hour long.
Right.
People are going to be like, oh, this is too long. I don't want to listen. So we're going to, if there was a take-home message, si t'avais comme un conseil ou un point or like something that like colleagues of all types of colleagues could apply in the here and now in their practice, is there something that you could suggest to your colleagues that when working with, I mean, all of these things apply to all of our clients, but we're talking about bilingual kids or multilingual kids. Is there something that you could recommend that could be like a practical, like hands-on thing that I can like go and do right away in my practice?
Well, you could lower the pressure on yourself to not try to hurry up and collect data. That's one thing. And you could listen to what the parents need without judgment. And it's easier said than done, because the judgment is unconscious in us because of what we were taught in school. This is where a child has to be at this age. Even if they give you like a little spectrum of from here to here, it's still sometimes way too high for where the kid is, and it puts a lot of pressure on parents. Yeah. Your child is 3 years behind or 2 years behind. So we don't need information like that. We need to hear what the parent says about where their child is, and then we can tell them just a little step up of where we'd like to get them.
Yeah.
So yeah, it's a couple of things there.
No, that's good. I mean, and a couple of things, they sound like little things, but like you said, our judgment and expectations are implicit, and it's kind of like it's a product of our education and the system and society. We can go into more detail about that maybe another time, but yeah. So I love that. So like taking the pressure off of ourselves, so enlever la pression et les attentes de nous-mêmes, d'essayer d'avoir toujours des résultats, et aussi d'être à l'écoute.
Mm-hmm. Oh, you know what's another one? I know we gotta go. We have to go. But to be transparent with kids on what you're working on.
Yes.
Don't try to trick them and say, today we're going to play games and then make them do 75 utterances. Tell them we are working on this sound and this game is going to help us get to that sound. Just be transparent. The parents love it too, and the parents understand too. Sometimes kids leave the room and the parents are like, yeah, you played with stars today? Like, not knowing we're working on like the STR blend, let's say. Yeah,
100%. I mean, it depends on their age and their language level, but I always try and explain in some kind of way what it is that we're working on, because then you're getting that implicit motivation.
Yes.
Et puis cette motivation qui n'est pas externe. Puis Maude Gagnon, orthophoniste, parle beaucoup de... Vous pouvez aller la suivre aussi sur ses réseaux sociaux. Elle parle beaucoup d'éliminer les motivations externes, d'arrêter d'avoir comme des jeux de renforcement, puis que ce soit interne. Donc, where do we start from? D'où on part pour avoir cette motivation interne? C'est d'expliquer le besoin ou la réalité, qu'est-ce que ça va apporter, qu'est-ce qu'on travaille. Fait que je pense que c'est très important. Très, très, très important. Je l'explique aux familles, mais il faut l'expliquer à l'enfant aussi.
À tout le monde, oui.
Ah, merci, j'adore ça, j'adore tes partages. J'aimerais ça te parler encore pendant des heures de temps.
On va se parler encore off the live.
Oui, mais alors, Liza, on peut aller te suivre. Liza donne beaucoup, beaucoup des belles anecdotes, des histoires, des expériences, des conseils sur les réseaux sociaux. Tu es sur TikTok. Ton compte TikTok, c'est...
Montreal Speech Therapy.
Et aussi sur Instagram, c'est la même chose, at Montreal Speech Therapy. J'adore te suivre. Tu fais partie aussi, tu es co-animatrice du The Bold SLP Collective. Et puis là aussi, j'adore vous suivre les filles. C'est vraiment une plateforme pour to raise, for your voices to be heard. And I love listening to you guys and learning and always keeping an open mind to just try and strive to be better, to be more open and listening and learning and knowing that I'll never, like, not feeling comfortable in what I'm doing, but always keeping on my toes, that like I can always learn from others, from families, from children. So thank you.
We want to just make sure we're always culturally informed, which is always evolving. You don't know who's going to be at your front door, you know?
I was going to say that too, actually. Yeah. So just quickly, it's culturally informed versus cultural competence. I think cultural competence is kind of like, it's not necessarily the right term to use because you never achieve a cultural competence. You're always learning, even being like a Canadian Egyptian. I can relate to some families because of my background, but I'll never be competent in what their culture is and their beliefs and their, you know. So
I don't know how you could achieve cultural competence, especially with the dual cultures and identities. Like you're Egyptian Canadian, I'm Sri Lankan Canadian. Like
you can't.
I'm not even competent in Sri Lankan Canadianism, whatever that is.
Exactly, because it's like a social construct that you can never be competent in a certain. So it's always knowing that we gotta be listening and ready to learn from in a dynamic way, like dynamic assessment, but also being dynamic with the families and having that back and forth, I think is really, really important. Thank you so much.
You're welcome.
Thank you to everyone who came. So Caroline Bugeaud said, moi je retiens de prendre le temps et de suivre le rythme des familles, de l'enfant. She says, merci beaucoup les filles, c'était très intéressant votre discussion. J'ai aimé le fait que c'était une discussion bilingue.
Phew.
Yes, alors merci Liza. On va se revoir à un autre moment donné. Bonne journée tout le monde.
Bonne journée, bye bye.